Welcome to the Pancreatic Cancer Action Network's webinar, Navigating Pancreatic Cancer Care During the Coronavirus. This is the second session of our webinar series about the coronavirus. At PanCAN, our goal is to provide you with information and resources so that you can make informed decisions. PanCAN can provide free, personalized information on many topics, including pancreatic cancer specialists and treatment options. Contact Patient Central at 877-2-PANCAN or email patientcentral@pancan.org. PanCAN would like to take this opportunity to thank the webinar sponsors, AstraZeneca and Ipsen, and to thank the scientific and medical affairs industry members, AbbVie, AngioDynamics, AstraZeneca, Ipsen, Janssen Oncology, Pfizer, Raphael Pharmaceuticals, TriSalus, and Time. Today's presentation is scheduled for 60 minutes, which includes time for questions. The questions that are relevant to today's topics and more general in nature will be prioritized. A recording of this presentation and the slides will be available under the Educational Events page at pancan.org. Now, I would like to hand off the presentation to PanCAN's President and CEO, Julie Fleshman.
Hi, everyone. Thank you so much for joining us. Again, my name is Julie Fleshman. I'm the President and CEO of the Pancreatic Cancer Action Network, and just thrilled that you're able to join us today for our webinar. First of all, I hope all of our attendees are doing well and staying safe during this unprecedented time. We want to make sure that you know that PanCAN is here for you. Our patient services or call center called Patient Central is open Monday through Friday from 7 a.m. Pacific time to 5 p.m. Pacific time. So please make sure that if you have additional questions after this webinar, that you utilize our call center and talk to one of our case managers. So I'm thrilled that we're hosting this webinar series about navigating pancreatic cancer during the coronavirus crisis. We're convening experts each month to answer your questions about pancreatic cancer and the coronavirus. And at the end of the webinar today, I'll provide you with the dates of some of our upcoming webinars. And if you missed the first webinar in this series last month, the recording is posted on our website and it covers some of the basics that we may not repeat today. So I'm thrilled today we've brought together two leading pancreatic cancer experts. I'm going to ask them some of the common questions that we are receiving through our call center related to the coronavirus and pancreatic cancer. I'll then ask our experts to respond to the questions that you're submitting through the Q&A panel. So please submit any questions you have at any time during the webinar, and we'll try our best to address all of them at the end. I also want to note that our panelists are not coronavirus experts. They're experts in pancreatic cancer, and they'll be answering these questions based on their experience with treating pancreatic cancer patients. They also both happen to be from institutions that were coronavirus hotspots, both New York City and Seattle. So it's now my pleasure to introduce our expert. Dr. Vince Picozzi is an oncologist and the director of the Pancreatic Program at Virginia Mason Medical Center in Seattle, Washington. He has served on PanCAN's Scientific and Medical Advisory Board for the last decade. He's also the chair of the Clinical Trial Consortium for PanCAN's Precision Promise clinical trial. Dr. Diane Simeone is a surgeon and the director of NYU's Pancreatic Cancer Program in New York City. Dr. Simeone is the immediate past chair of PanCAN's Scientific and Medical Advisory Board. She is also the chair of the steering committee for PanCAN's Precision Promise initiative. So I'm just thrilled to have both of them here. Welcome, Dr. Simeone and Dr. Picozzi. So let's get started. Dr. Simeone, let's start with some basics. What is the coronavirus and how is it different from COVID-19?
So, Julie, it's a pleasure to be here, and I just want to thank you and PanCAN for hosting this webinar to provide critical information for our pancreatic cancer community. So the question is, what's coronavirus and how does it relate to COVID-19, which is a term we hear bantered about. So coronaviruses are forms of viruses that actually aren't new. There are a handful of viruses that are known to cause respiratory symptoms, much like the common cold. So even though there are many types of coronaviruses, what this particular pandemic is due to is a new, very specific coronavirus that was not previously known to affect humans, and it's called COVID-19. 19 because it was first reported to emerge in China in December of 2019. And of course, COVID-19, the disease, has resulted in many devastating health problems across the world, with causing a lot of cases of pneumonia, organ failure, and death, with a death rate of about 1%, but certainly causing up to other kinds of symptoms. We'll be able to talk about that a little bit more today.
Great, and probably many of our listeners are wondering, what is the relationship between COVID-19 and pancreatic cancer? What do we know about it?
So the thing we do know is people are at the highest risks for complications from COVID-19 are those people who are a little bit older, generally people over the age of 65, patients who may have or individuals who are immunosuppressed or immunocompromised, those with chronic or underlying medical conditions like heart disease, diabetes, and lung disease. Certainly people who have been treated with cancer in the past or people who are actively being treated with cancer may have weakened immune systems, and that can increase the severity of risk for illness with COVID-19. Certainly you've heard it being espoused by the CDC, but it's very important that anybody that has pancreatic cancer take appropriate precautions to mitigate their risk of getting an infection and the severity of the infection. And those are social distancing, keeping away from crowds, wearing a mask anytime you're out in public, that's really a big one, and of course, frequent hand washing.
Great, thanks. Dr. Picozzi, you see a very high volume of pancreatic cancer patients. Maybe you could talk a little bit about what's been your actual experience with pancreatic cancer patients having COVID-19.
Okay, well, thank you, Julie. First of all, thank you so much for inviting me to participate in this webinar. It's a tremendous honor to do so. And I so much appreciate what PanCAN is doing to maintain awareness and understanding of pancreatic cancer in this novel, unique, historic, difficult time that we live in. First of all, I want to emphasize that really having pancreatic cancer makes you not fundamentally different than any other person who is at risk for developing or acquiring coronavirus. The average age of people with pancreatic cancer is 71, and as Dr. Simeone alluded to, patients with coronavirus, patients who have medical risk factors do seem to be, such as age or other medical conditions, do seem to be at higher risk for developing the virus, although not necessarily experiencing increased severity. So first of all, it's really important for patients with pancreatic cancer and their caregivers, I want to emphasize, and family members, to follow good hygienic practice in an attempt to limit the spread of the virus. And in addition to those that Dr. Simeone mentioned, I would emphasize being obedient with respect to shelter-in-place edicts where they exist, the concept of minimizing your travel or exposure if you can, not touching your face or hands as much as possible, and in fact being in close touch with your provider in case medical issues arise. Now, fortunately, here my experience has been in Seattle that the populace in general, and my patients in particular, really have been exceedingly good about following hygienic standards to reduce the spread of coronavirus. And so the pragmatic impact on my practice has been surprisingly little. I actually have yet to encounter a patient that's been diagnosed with COVID-19. That's somewhat surprising because it's felt that the total exposure in King County, where Seattle resides, is currently about 6 to 8% of all people. But in fact, I have been able to execute care and execute my practice with very little direct intrusion from the virus itself, which is very encouraging.
Great. And Dr. Picozzi, I think it could be confusing what we see on the news and in the media. So are there more or less cases of coronavirus being reported now?
So that actually depends, Julie. It depends on several things. First of all, it depends on exactly where you live. It depends on how much testing is taking place. It depends on how data is organized and conveyed. So there's not a clear answer to that. Here in Seattle, which again was one of the origin sites of the virus, it is clear that although people are still acquiring infections, the rate of infection and most importantly the rate of death is clearly dropping. So we do feel like we've turned the corner in terms of the viral infection, at least in the immediate present. Although, because the virus remains an issue, our governor has issued a shelter-in-place edict for the remainder of the month. Now, that's not true of other parts of the country or even other parts of the state, but it is the reality here in Seattle.
Yep. So, Dr. Simeone, Dr. Picozzi mentioned testing. Should pancreatic cancer patients have COVID testing before receiving care?
So I think if possible, all patients with pancreatic cancer should have COVID testing before starting treatment. That also includes any patient who may be getting ready to undergo surgery. Of course, that has been challenging in the situation where we've had limited access to testing, but fortunately things are starting to improve. We are currently testing all patients here that are seen at NYU. Certainly for any patients that have symptoms, we would not advise starting cancer therapy or having surgery until symptoms resolve. Interestingly, we have had some asymptomatic patients test positive, and then the question arises what to do in that setting. For the few surgical patients that we've seen that have been asymptomatic and tested positive, our policy has been to wait 10 days, and if they continue to be asymptomatic, then we go ahead and perform surgery if it's medically appropriate. For patients that need chemotherapy, those decisions are made on a case-by-case basis in the context of our multidisciplinary tumor board. We've actually had about 3 or 4 patients that are in active treatment that have developed COVID-19, and so we've had to manage that in the context of their treatment. So I think in general it's a good idea to get testing if you can, especially when you be undergoing procedures that may be immune suppressive in nature. Another important point to realize is there's a lot of diversity in what's happening in the clinical setting, whether you can bring family members with you, either to the clinic or into the hospital. So it's good to call ahead and find out what the particular situation is at the setting you'll be getting your care.
Great, thank you. Dr. Picozzi, I think, there's a lot of fear right now about going to the hospital or going in for an appointment. So should patients be skipping routine checkup or treatment appointments to avoid being exposed to COVID-19?
A very important and frequently asked question, Julie. In my mind, I divide patients into 3 groups: those undergoing diagnostic testing to establish a diagnosis, those on active therapy, and those under surveillance. And I think the answer to that is different for each of those 3 groups. For patients who are suspected to have pancreatic cancer undergoing active evaluation, I think it's critically important that those patients keep their appointments without delay. Pancreatic cancer can be such an aggressive disease that delays of even short amount of time can compromise outcomes. So people undergoing diagnostic evaluation absolutely should keep their appointments as scheduled. For patients under therapy, I think the answer varies. Patients being treated with curative intent, I believe, should maintain the standard treatment schedule. That completely applies for surgery. Surgeries, in my view, should not be delayed when a diagnosis of pancreatic cancer is suspected or established. And people on chemotherapy being treated with curative intent should try to maintain treatment schedules as best they can. Patients who are being treated, however, with quantity and quality of life as a goal and not cure may be best suited by deferring or delaying treatment depending upon their individual circumstances. For the third group of people, people under surveillance, there generally appointments can be delayed safely without compromise unless the patient's symptomatic.
Great, thanks, Dr. Picozzi. And also, we're hearing a lot about telemedicine. So what is the role of telemedicine specifically with pancreatic cancer?
Well, I'll give you my personal opinion, Julie, but others may differ. I think telemedicine is great for dealing with patients who live at a distance where travel is very awkward, and the major content of the visit is one of dialogue or consultation or advice or sharing of information. So under those circumstances, when you don't need to do a physical exam, you don't need to do a lot of sophisticated testing, telemedicine, I think, is great and actually may replace standard visits for the foreseeable future. For patients, however, who require treatment, which is the majority of mine, people on chemotherapy, they do still have to come to the clinic and have their visit in person.
Yeah. And is it possible to receive treatment at home?
So currently, it is, in general, not possible to receive treatment at home for many, many different reasons, safety being foremost amongst them.
Great. Dr. Simeone, so if the patient's appointment is canceled by the physician or by the hospital, what should they do?
Well, if your regular appointment gets canceled, then you should actually really reach out to your healthcare provider to figure out what the next step is. I would say at the very peak of the pandemic here in New York City, things were put on a pause for about a week or two, just so all the hospital systems could adjust to put plans in place to minimize risk for patients. And of course, as Dr. Picozzi mentioned, this is hitting different parts of the country in different waves, so it's really changing in real time in different parts of the country. And as health systems adapt to this, it's important for patients to keep in touch with their doctors to see how things are changing in their local environment. We really have felt very strongly about advocating for patients. We don't want them to miss appointments or to miss a cancer treatment. But of course, during the peak of the pandemic, we had to balance that with the risk of exposure to infection and also understanding the patterns of spread and the risk of infection with disease, which now I think we have a much better handle on. And as Vince mentioned, in some settings, approaches can be delayed or modified. In other settings, it's not appropriate. I will say we've gotten quite good at telemedicine. I'm kind of old school, as is Vince. I like to see my patients in person. Almost every visit ends with a hug. I'm sure Vince is the same. But certainly we have offered telemedicine visits to patients if they're more comfortable or request it, or if we can do things and they don't have to come. I had already really done that a lot for my patients. If they want me to look at an incision, I just have them send a picture on their iPhone and I have them give me a call. So we can deal with a lot with telemedicine, but obviously not during active treatment. And certainly, I think any new patient with pancreatic cancer, it's always better to be able to have that conversation in person so that you can develop a relationship with your patient. I will tell you that most cancer centers on the country are being very diligent in making sure if patients come in that they're creating a very safe environment. Here at NYU, all of us faculty and staff are actually been tested for COVID. There are temperature checks at the door. There's social distancing put in place. You're given a mask when you come in. So it's really to create as safe an environment as possible. And in the hospital, where cancer patients are, especially patients we operate on, it's a COVID-free zone, well away from any patients who have active COVID infection.
And Dr. Simeone, as a surgeon, what should patients do if their surgery is canceled or they disagree with what the decision of the healthcare provider?
Yeah, so this is been an important topic, and I will say, being here in New York, we probably have the most acute issue with this. I feel it's very important that needed surgery is not delayed for patients. in the absolute peak of the pandemic here, which is now, a number of weeks ago, we had a 2-week period where we didn't perform surgery. But after that, even while elective surgeries were on hold and remain on hold in the state of New York, we were able to perform surgery on pancreatic cancer patients because we made the case that it was medically necessary. All of our patients get reviewed in the context of a multidisciplinary tumor board, and we have consensus that the surgical procedure is necessary. Such patients that we've operated on during that time, and there were days where I might be the only person operating at NYU, or maybe the only 2 or 3 rooms going. Is very eerie. It's usually a very busy place. But patients who had been on neoadjuvant therapy for borderline or locally advanced disease, that they had finished their treatment and were ready for surgery. Patients that having a timed surgery was part of a clinical trial. Those are patients that we really pushed for and successfully operated on during that very critical time. For patients who have resectable disease, during that time, we tended to start them on chemotherapy with a sandwich approach, where we would plan to give 3 months of chemotherapy followed by surgery, and then 3 months of chemotherapy after surgery. And that's that's an accepted approach, even absent of this setting. Now the operating rooms are opening up more broadly, and things are loosening up. But, I think what has worried many of us, and Vince and I have talked about it as we have, Julie, is it seems like the number of pancreatic cancer patients that have been coming in for care has diminished. And so we're very worried that people that need care are scared to come in because of their worry about infection. And we just want to really try to allay those fears that it's quite safe to come in and see healthcare professionals if you're worried at all about having a new pancreatic cancer. If you try to do that locally and find that there are obstacles, please reach out to PanCAN, or PanCAN can provide you with centers that are very willing to help you navigate that.
Yeah, great. And maybe just a point to follow up on that it really is safe to go to the hospital because there's so many new policies and procedures, as you both have talked about, that are in place right now to keep people safe.
I feel I'm at work now, and sometimes I feel the hospital is the safest place to be. Everyone's wearing a mask. All the things that we've talked about are all in place. Things are very rigorously monitored to have things be as safe as possible for patients.
Great, thanks. Dr. Picozzi, many patients are being told right now that they can't enroll in clinical trials. Can you talk a little bit why some clinical trials are stopped or why there are delays?
Yes, I can, Julie. First of all, as Dr. Simeone mentioned, there has been a decline in patients being referred to Center of Excellence for treatment in general, which obviously includes participation in clinical trial. Patients have been reticent to see primary care doctors about symptoms, or the primary cares have been unavailable. There have been issues referring to specialists for diagnostic testing. So the total demand, shall I say, for clinical trial participation has diminished. There also have been some significant logistical challenges with respect to operation of clinical trials, even at major medical centers. Here at Virginia Mason, we have kept our clinical trial program going for the most part, but we have had to make some compromises. Our research staff are being told to work off-site by and large, and so we don't always have staff available to interact with patients or access data as quickly as we would. There have been restrictions placed on doing procedures such as biopsies that are necessary for clinical research, and so those things have made it harder to have patients participate in clinical research. And along with that, we do have a ban here on opening new clinical trials, but have focused instead on maintaining the trials we have. So we've been able to maintain our clinical trial portfolio in pancreas cancer and otherwise, although with some difficulty and some slowness. Now, other centers, including some very prominent centers around the country, have actually put a complete prohibition on new patients or new patient accession in clinical trials, either due to some resource limitation or concern about infection. So again, it varies substantially around the country, but suffice to say, this has been a challenge for every major medical center in the country, and for the Precision Promise program certainly too. Every single center has been challenged to a varying degree in terms of its ability to participate.
Thank you. And Dr. Picozzi, people want to understand, how can they find out if the drugs that they're on for their pancreatic cancer care might be putting them at risk for COVID-19?
Okay, let me give maybe three answers to that, Julie. First of all, there's not really a lot of good data on chemotherapy risk and COVID-19 infection. The data that seems to exist to date is that the chemotherapy does not seem to, or having cancer in general, does not seem to increase your risk of acquiring the infection. It seems to impact on the severity and the complications of the infection. Secondly, chemotherapy in pancreatic cancer tends to be fairly non-intensive compared to other treatments to begin with, or other disease to begin with, because again, the people are older, they have other medical conditions that hamper chemotherapy. So our chemotherapy is not quite as impactful as is typical in other cancers. Thirdly, under these conditions, I personally have been relatively conservative about how I dose the chemotherapy and administer the chemotherapy. Really wanted to be even more cautious about avoiding risk of infection in general, as I would under even other circumstances. So I would say those three things in general, but to date, nobody actually even knows exactly what the incremental risk of acquiring COVID-19 is with any particular chemotherapy or even chemotherapy in general.
Great, thank you. Dr. Simeone, as a member of our Scientific and Medical Advisory Board and chair of the Precision Promise Steering Committee, and maybe just using PanCAN's programs as an example, can you talk a little bit about some of what we're experiencing at PanCAN with our Know Your Tumor service, with our Precision Promise clinical trial?
Mm-hmm. So, as been discussed, one of the significant issues that has arisen during the really acute phase of the pandemic is access to clinical care and access to clinical trials. And as Vince mentioned, and to my surprise, there are some centers that just stopped seeing new patients, and clinical trial programs are completely closed. Many centers looked at individual clinical trials to weigh the potential benefit for patients. As you know, to enroll in Know Your Tumor Precision Promise, a biopsy is required, and some centers have been putting a hold on obtaining biopsies or obtaining biopsies that are related to research. Now, the good news is that these restrictions are starting to lift in many places around the country. We have been very concerned about cancer patients during the pandemic, and I think all of us, certainly talking to all my colleagues that I interact with through PanCAN, want to make sure that we do not compromise the care of our patients. And I can assure you that doctors are carefully weighing the risk, as Vince mentioned, of missing a treatment or altering a treatment versus the possibility of exposing a patient to the infection. And so there's been a lot of institutional variability, and I think that's what's been difficult for patients to navigate.
Yes, I think you're right. And for our attendees, if you have questions about PanCAN's Know Your Tumor service, which is a personalized medicine molecular profiling service, you can call our call center, and our case managers can provide you with more information. And Precision Promise is a clinical trial that PanCAN is sponsoring that you can also get more information about through our call center. Dr. Picozzi, do you have any suggestions for communicating about patient care with loved ones if the caregivers are not allowed to accompany the patient to their appointment?
That's a really excellent question, Julie. Again, this is something that varies center by center. In our center, caregivers are not allowed in the hospital to be with patients who are hospitalized, except under very exceptional circumstances. The clinic permits one visitor to be with each patient, and occasionally two if they need a translator or they're in a wheelchair, but family access is restricted. So the general points of advice I give are, number one, make a list of the questions you'd like to ask before you come to your visit. In fact, this is something I advise all of my patients to do. And typically, at or near the beginning of the visit, we start with a recitation of the patient's questions to be sure they're answered. Secondly, I personally am fond of having people tape record discussions. In that way, first of all, they themselves can hear information repetitively, which is useful, and also they can share it with others at sort of a first-hand basis. And thirdly, we can work it out under some circumstances to have relatives call in and participate via speakerphone on clinic visits. So all of those things I think are useful, along with tracking your medical information on your on the electronic medical record that now virtually all patients have access to at home.
Great. Yep, those are both great suggestions. Recording the office visit, as well as obviously people can call in on a speakerphone. So if someone in the patient's home is symptomatic for COVID-19, what should that family do?
So if there's a person in your family or family unit that is diagnosed with COVID-19, that person needs to be put in isolation, which means their access has to be restricted from all other people, which means you're in your bedroom by yourself. People don't go in. The food is left at the door. You try to use a separate bathroom if you can. Things are exchanged using gloves and masks, just like they would be in the hospital. So you want to try to isolate the patient, and along with that, presumably their infection risk, their contagion risk, from everybody else in the family unit. Now that's different from a quarantine. Quarantine means you don't travel around. You stay in the house and you can interact with each other, but you don't go out of the house or travel. Isolation means the person is actually physically separated from all others in every way possible.
And in the case specifically of if there's a pancreatic cancer patient in the family or in the house, do you recommend isolation of the person with COVID-19?
Yes. Well, that would be true of anything, whether a person has pancreatic cancer or not. Would be true. So, but it's particularly important if you have a condition like pancreatic cancer. So. Great.
Dr. Simeone, what should a patient do, kind of back to this topic, what should a patient do if they start experiencing symptoms of COVID-19?
I think one of the most important points for us to get out there is don't hunker at home and suffer. Please reach out to your doctor and let them know what's going on. The symptoms can be very varied. It can be unexplained fever, cough, sore throat, headache, shortness of breath. Sometimes it's a kind of a silent shortness of breath. I've even had individuals say their symptoms were all GI, diarrhea. So if you have symptoms that are unexplained, please reach out to your doctor. I think that we're past the wave where patients have to be scared to go into a medical facility to be evaluated. COVID testing for patients that have symptoms is becoming more available, and certainly we don't want people to get a delay in getting evaluated. I think that's one of the problems that led to people getting so sick before they came in, and if you wait till you're too sick, then obviously it can compromise your outcome. So I think we're past that severe wave, and certainly I think we have a better understanding. Systems are in place in hospitals, and it's now quite safe to come in and get evaluated, or at least reach out to your doctor to make that call of whether you need to come in and get evaluated.
Great. Yeah, and I think that message overall is so important that people should not fear going to the hospital if they need their care or if they think they have COVID-19. That there are a lot of procedures and policies in place to keep people safe. So I think that's an important message. So I want to turn to, we've got questions coming in from the attendees. But before we do that, Dr. Simeone, could you just go over some of these quick tips for people?
Sure. So let's just go through them to hit the highlights. I think what we tried to say is stay connected to your healthcare team and make sure you have a healthcare team that's responsive. If you need help, it's 911 PanCAN. There's an amazing team there that if you're in a part of a country where you're struggling to have your healthcare team be responsive. Check the CDC website for information updates. I've actually hopped on there a couple times when there's some ambiguity about how to address a certain issue. I think number 3 is really important. Just have plans in place if either you or your caregiver get COVID-19. Vince talked about isolation. Make sure that you have masks around, gloves, you have a strategy that you would have in place, have a backup plan for care. These other points are really important about staying away from other people, staying away from crowds, wearing a mask, social distancing. These are the safest, these are the things that are going to keep you safe. I can't encourage you enough to wear a mask. While the mortality rate with COVID-19 is relatively low, it's probably about 1%. It is a very highly contagious virus, so the safest thing you can do is wear a mask. And then certainly there are a lot of resources around. If you're struggling with any issue, please reach out. And obviously PanCAN is known to be a go-to source for all patients around the country with pancreatic cancer.
Great. Thanks for that review. And to all of our attendees, please continue to submit questions. Again, just click on the 3 dots at the bottom of your screen, and then you can submit a question through the Q&A. So, Dr. Picozzi, here's a question from one of our listeners. This particular patient was diagnosed with stage 2B pancreatic cancer and just had their first round of chemo with 11 more rounds to go. And they have 4 young adults in their house all summer. And so they just want to understand how they balance the need to socialize and be together with the need to keep the pancreatic cancer patients safe.
Okay, that's a great question, Julie. And I was thinking of it when Diane was reading through these quick tips. We use the phrase social distancing, but what we really mean by that is physical distancing. We want to physically stay 6 feet apart, but we don't want to emotionally stay 6 feet apart. So it's very important that people with cancer feel supported by their loved ones and that they can share. And so it's important to erect ways that those kinds of feelings and communication can be conducted. Let's see, being the father of 3 now adult children, but thinking back to when I was situation, you could think of activities that could bring people together but still distance them. Dinners where everybody's sitting, around a room 6 feet apart. Discussion sessions, listening to music, watching a movie. Different things that bring you together as a group, as a family, that enable you to feel connected.
Great, thanks, Dr. Picozzi. That's a great answer. Dr. Simeone, so this individual has surgery scheduled next week. It sounds like they have to travel to another state for the surgery. They just want to understand what sources would they use to determine the regional status, whether they should go, what they should do?
Well, I think that is going to come up. Certainly, if you pick a healthcare team that's not in your locale, you have to weigh the pros and cons of doing that. And I think in times that can be appropriate. That's obviously a personal decision. if you're going to do that, I would reach out to your healthcare team and find out some of the logistics. There are plenty of states where hotels aren't readily open. Make sure you have a landing spot. Find out what the local situation is. They may help provide guidance as the best way to travel, whether it's better to hop in a car or if it's better to hop in a plane. Those are decisions you have to weigh carefully. Just like any time when someone has a new diagnosis with pancreatic cancer, and we've always emphasized this, it's not an emergency. You want to collect your information to make the wisest decision about your care plan. So if you need help with trying to weigh the pros and cons of travel versus staying locally, you can certainly get a second opinion about that from PanCAN, for example, where they can help you understand whether where you're seeking care locally versus, a little bit more remotely, what the experience is, what the team's like, they can probably help provide some guidance there.
Great. Dr. Picozzi, this patient is having, sounds like maintenance therapy. There is no active cancer, but they're still going in monthly for treatment. But their treatment has now been postponed until June. And they want to understand, is that okay? Or should they be continuing their maintenance therapy?
So, Julia, to answer that one, ideally, I would need to know more about the exact circumstances that the patient is in, but in general, in all areas of pancreas cancer, there's no proven role for, quote, maintenance, unquote, therapy. So if a treatment course has been completed, in general, we don't put people on, with very few exceptions, drugs or therapies of any kind just over the course of time. So I guess my advice to this person would be to ask the provider, why are we doing this therapy? What's its significance? What's its demonstrated significance? Do we need to do it at all?
I would add that, perhaps the only exception to the, documented role of maintenance therapy would be for BRCA mutant patients with PARP inhibitors. I don't know if that's the particular scenario we're talking about. That's an established maintenance therapy that's FDA approved. But I agree with Vince's point that, it would depend on the particulars.
Great. Dr. Simeone, so a patient who had stage 4 pancreatic cancer, they've successfully finished their chemotherapy, so they're only on surveillance. What is their risk of COVID-19, or what should they be thinking about with regards to COVID-19?
So if they're on a pause from their therapy and they have stage 4 cancer and they've had a good response, then the timing and duration of that pause will be dictated by their healthcare team. But it gets back to some of the things we talked about. I'd be very careful about exposure to others. Sheltering in makes a lot of sense. Wearing a mask if you go anywhere, if you absolutely need to. A lot of people are successfully really sheltering in by having food delivery if that's possible. So, this is a time where you are susceptible, and really trying to put all those rules in place that we've talked about, I think, will pay off. Great.
Dr. Picozzi, if someone is weighing, they're currently getting infusions for their treatment, and they're weighing whether they should change and get oral treatment, how might they make that assessment?
Well, Julie, most chemotherapies or most drug treatments for pancreatic cancer are intravenous and not oral. So most intravenous drugs don't have oral equivalents. There's one exception to that in some circumstances, the use of a drug called capecitabine can be interchanged with 5-FU. But by and large, you can't substitute one kind of a treatment for another based on oral versus intravenous. So in general, patients should remain on the form of treatment that they're on.
And I agree with that. I think we see a lot of trimming of treatment, not doing treatment, and I really I think we have to be really diligent and make sure we don't shortcut or compromise appropriate treatments for patients.
Yeah, I think just to put it in summary, Julie, as terrible and difficult and awful and horrendous a problem that COVID-19 is, particularly on a population basis, for the individual with pancreas cancer, almost always the pancreas cancer is a much more severe problem than the risk of COVID.
Good point. Dr. Simeone, there's a few questions here about how do patients know if they're still immune compromised after completing chemo?
Well, I don't know if there's an exact test we can do, but in general, it takes several weeks for the immune suppressing effects of chemotherapy to wear off. And for example, when we make decisions about operating on people after they've gotten chemotherapy, we usually wait at least 3 weeks before we plan to do surgery. So I would say probably a 3 to 4 week window is probably the time frame where people will be most at risk. Vince, would you agree?
Yes. Again, the treatments we use, drug treatments we used in pancreas cancer aren't particularly immunosuppressive. And so unlike other cancers, say if you're being treated for leukemia, I don't see the drugs as profound a risk for acquiring infection. As you know, Diane, the immunosuppressive risk of surgery is more after the surgery than before the surgery. And something we have to think about, too, is that pancreas cancer itself is immunosuppressive. And so by allowing the disease to progress and be untreated, that in itself poses a risk to infection. So all of those things have to be balanced. But in general, I think one wants to maintain their treatment schedule as best they can.
One point I will add, and this will only apply to a small subset of patients, but if anyone is getting treatments that include a immunotherapy drug as part of their regimen, one thing that we're doing for all patients who are on an immunotherapy is they're actually getting a chest CT before they start therapy. It's less relevant for pancreatic cancer because fewer patients are getting those regimens, but if there are any patients out there that are on clinical trials or for some reason are getting an immuno-oncology drug, I just wanted to bring that point up.
Great. Dr. Picozzi, when you see patients in the clinic, are you requiring them to wear masks during their appointment?
Yes, we do. And if you come without a mask, we're happy to give you one. And so the policy is that every single person, patient, supporter, caregiver, staff member, has got to wear a mask. And actually, the providers also wear eye shields or face shields or goggles in addition. That's right.
Yes, and Dr. Picozzi, you actually joined the webinar at the very beginning before we joined all of our participants with your mask on. There you go, both of them with their masks.
What I normally look like. So this is my mask, and here are my goggles. And as soon as I set foot outside this room, I've got to put these things on. So.
Yes, both Vince and I wanted to point out we're both in our offices isolated, and that's why we didn't have a mask. But this is how we look when we see patients, or even when I conduct televisit appointments, because I'm usually in an office with our nurse practitioner. It bums me out because I can't drink coffee while I'm doing my televisits, but we do believe in wearing masks. All the patients wear masks, and this is, again, a very critical point. And there's been discussion about what kind of mask you have, and the best mask is any mask you can have, but if you're able to, the surgical mask will filter about 60 to 80% of viral particles. An N95 mask will get over 95%. So if you're able to get an N95 mask or some version like that, it's a little bit better. Granted, they have been in short supply.
But it is important to remember the mask is really a backup preventative for people who are not sheltering in place or not physically distancing themselves. That's why we wear a mask. If everybody was or could be absolutely compliant about that, the mask would have much less importance.
Let's see here. Dr. Picozzi, this patient had surgery and had pre and post-surgery treatment, and they're now scheduled for chemoradiation, which has been delayed. Is there any reason why radiation might be delayed now?
My personal answer to that would be no. As many are aware, the role of chemo and radiation therapy in a treatment sequence such as has been described can be somewhat debated, but in some patients. But if that's the treatment plan that has been determined to be best for this patient, I would strongly advise that that be executed as planned.
Okay, let's see here. So here's another question sort of about family. Family from out of town wants to come visit. Is it safe for them to spend the night if we follow all the social distancing guidelines and wear masks if they have no symptoms?
If it's a pancreatic cancer patient, I would say I would hold off on that. For the reasons we talked about.
I mean, that would be a violation of sheltering in place. So, a better strategy would have a Zoom party.
Yes, we're all getting very good at those, aren't we?
Right, that's right.
Let's see here. So this is a good question, maybe good for Dr. Simeone in New York. What if public transport is the only means to access cancer care right now, or for this person to access cancer care?
Yeah, so I think it's safe to use. The City of New York has done a lot of thinking and work on addressing the public transportation issue. The truth of the matter is the number of people that are actually using public transportation right now is quite low. Things are a lot less crowded. In fact, the subway system, I think, closed down for the first time in its history this week to get thoroughly cleaned overnight. So if that is what you need to do to get your care, I wouldn't avoid it. Again, mask, Purell, social distancing. I think if you do all those things, then it would be totally fine.
Great. And a couple more questions here about masks. This person lives in a place where they're not required to wear masks outside, but they're wondering when they go on walks outside, should they actually be wearing a mask if they're on chemotherapy?
So I don't think it would hurt to do it, Julie, but a mask is much less important when you're outdoors as opposed to indoors, provided that physical distancing is maintained. So when I'm trying to get exercise at home, I do take my mask off.
Yeah, I agree. As long as you can keep plenty of distance from other people, then you don't need to wear a mask. I've been doing a lot of running, and things are pretty spread out, so I'm not wearing a mask. But if you in certain areas, it's a little bit more crowded, especially if it's a warm, sunny day. So even if you're outside in those situations, if you think there's a chance that you might get close to people, you can wear a mask.
Right. Remember, the mask is a backup to physical distancing. It doesn't. It's not a substitute. So.
Great. All right. One last question here. Another mask question. Can masks be reused after exiting the cancer care facility after an infusion?
So I can answer that one. Masks can be reused. I'm wearing the same one right here. I've been wearing all month. They can be reused. If you come into the building, if you don't have any direct exposure to a COVID patient, we've been reusing the masks. It's quite safe. Some masks are even getting recycled. That was really prevalent when there was a shortage. So if you have a good mask, you can reuse it. Now, surgical masks, those are more plentiful, so it's easier to use those and toss it after you are out and about, but certainly you can reuse masks.
Great. Thank you. Well, I think our attendees did a great job asking some good questions. I just want to thank Dr. Picozzi and Dr. Simeone. This was great. I think a good discussion and a lot of helpful information for everyone. For all of our attendees, the PowerPoint slides and the recording of this webinar, which might be helpful to listen to again, sometimes you have to hear these things a few times, will be made available at pancan.org under the educational events page within the next week. So thank you for your patience as we get that up there. Once again, I just want to thank our webinar sponsors, AstraZeneca and Ipsen, and our scientific and medical affairs industry members, AbbVie, Angiodynamics, AstraZeneca, Ipsen, Janssen, Pfizer, Rockdale Pharmaceuticals, Trisolus, and Tyme. So thank you, everyone, so much for your participation today. After this, you're going to receive an email. A survey will pop up once you're exiting this session today. And we'd really appreciate it if you take a few minutes to share your feedback. It helps us to improve our webinars in the future. And once again, just a reminder to please call our Patient Central Call Center and speak to a trained case manager with any questions that you have about your care and treatment. And the number and email address are up on the screen. Finally, I want to show you our upcoming webinars. We have a webinar on immunotherapy for pancreatic cancer on May 13th, and another webinar on navigating pancreatic cancer during the coronavirus crisis on June 11th. You can go out to our website to register for these, and you'll also receive an email so that you can register as well. So thank you again to our participants. Thank you again, Dr. Simeone and Dr. Picozzi. Great discussion. Please, everybody, stay safe and stay well.
Stay safe, everyone.
Take care.
Thank you.